Thank you, Derek. I love the amazing on there. I'm going to have to add that to how everyone addresses me. But anyway, good morning, everyone. Thank you for having me. My name is Angela Matthews. I'm the Senior Vice President of Gaming and General Manager at Thistledown. So I oversee our gaming departments at both properties. So that's table games, slots, poker. We have a play for fun site, and then also general manager responsibilities for Thistledown. I wanted to start by saying Jack's commitment really to responsible gaming shows not only on our team member side, but on our property as well, and aids in our guests going through. I think I want to kind of give props to Ed and Lisa, as they've really done a great job in identifying our guest journey, if you will, through our property and going through the traffic patterns, all of the points of decision where a guest is making a transaction for cash. There is responsible gaming information. The hotline is on all of our cash machines, at our cage, and ATMs, everywhere that there is a point where our guest is going to make a decision. They have information readily available, and we all know that it's not always easy for one of our guests to go to a team member to talk about this person to person. So I think that having that information visible and available is so important, and kudos to them, because I think that really shows how important it is to have that for our guests. From a team member perspective, we training is very important, and so it's required for all of our new hires to complete, sorry, that word escaped me, complete training prior to them starting. There is no grace period of, they get to start and they have 30 days to complete. No, it's you have to complete it before you work. And then annually we have training just to make sure that our team members, including myself, know this information, not just study before a test. They actually know it, they practice it, and they're there to help when needed. So again, this is all really important just for our industry. We have to be responsible, to be the best, right? I mean, we have to cover our guest needs as well as our industry. So again, thank you for allowing us to share a little bit about Jack. It's my pleasure to introduce the amazing Julie Hyne, MACPS, is Executive Director of the Oregon Council on Problem Gambling. She has focused her work in the problem gambling field since 2002 with roles as the Director of Responsible Gambling with the Massachusetts Council on Compulsive Gambling, Coordinator of Prevention Lane's Problem Gambling Prevention Program, instructor at University of Oregon, and investigator of the 2016 U.S. Problem Gambling Services Survey. She provides technical assistance across the U.S. and in 2012 was honored with the National Council on Problem Gambling's Welfing Prevention Award. She is currently Secretary of the National Council on Problem Gambling Board of Directors and a certified prevention specialist. Amazing.
That was an amazing introduction.
I know, the word of the day is amazing. I'm going to keep using it. I love it. It's nice to meet you.
It's nice to meet you too. And anything that's positive, it's awesome to be able to share. And I just want to say thank you so much to PGN Ohio and the events team and all those who collaborate in Ohio. Just listening to Derek introduce the wonderful people like Dr. Heather Chapman, you have such rich resources in Ohio. And so I'm just really, really grateful to be here with you this morning. And so what we're going to do today is we're going to have a hopefully very collaborative session together. What we're going to walk through is some current conditions and barriers, some strengths. We're going to talk about the spectrum of services and what's called the SPIF, which is a strategic prevention framework, which is not just used in prevention. And then finally, we're going to talk a little bit about allies and collaboration. To back up, I'm sorry if you wanted to lean back this morning. Believe me, I'm fully aware that you probably have like 37 different emails coming in your inbox, probably right at this moment. You probably have people calling you. This last year, if you didn't have a dual monitor situation, you probably do now, and one of them's on Zoom and one of them's on your growing email inbox. So I just want to take a time to appreciate that and all that you have going on, and that you're probably on a bunch of different Zoom things. And I really hope that this session is truly collaborative, that we can engage together, because I think that's where we're going to be able to learn together and be able to hopefully come up with something new to be able to practically address in our work. So this is the famous George Costanza of Seinfeld, and George was really an expert in leaning back, and we're going to try to lean forward this morning as much as we can with our very taxed selves. So to that end, I just want to set this up by saying I'm not pretending to be an expert on Ohio and what you all are doing. Not here to throw some stuff and tell you what to do. You're experts in your state. You're well aware of what's going on and the connections that you have. And to that end, we really want your engagement and expertise, because that's how we're all going to be able to grow and learn together in this next little under an hour and 15 minutes right now. So please do, as Derek said, we want this to be engaging and collaborative. So throw stuff in the chat box, throw stuff in the question and answer, and we'll try to get to those as we can along the way. And if you have any questions right now about the content of anything, feel free to go ahead and ask. What I'd like to do is sort of set the tone here by thinking about something that's a real issue that you're addressing in Ohio with your work. So think about something that you really wish you could collaborate on, that you're feeling stuck with, that you're feeling perhaps you may know somebody that you want to connect with and partner, but you don't know how. And the more specific you can be with this thing, it will help. And if you do feel comfortable enough in sharing in the chat box, something that maybe is an idea that you have, if you want to inspire maybe other people that may be stuck with, I don't know, I'm just thrown into the session right now. I don't know what the heck she's talking about as far as collaborating. Think about something that you wish you could collaborate on. And if anybody feels like they're comfortable enough to put something in the chat box, or if you want to raise your hand and we can see if you want to unmute, we can try that as well. But please put something in the chat box. What's something that you really wish you could connect with somebody else on, and you just you don't know how? One example in my state is we oftentimes feel stuck with our tribes. And I know in Ohio, you don't have tribe casinos, but we sometimes feel stuck. We're like, how do we collaborate with folks around maybe getting RG messaging? And maybe you want to collaborate further with Angela, but you don't know how. So there are some things here that we can think about as far as understanding our work a little bit better. If you're in treatment, what's something that you can think about if you could change the way that you do things, if you could connect with somebody on it and change? And maybe right now, this doesn't feel like it's resonating. Maybe as we go through the content, maybe some things will spark some ideas for you. So let's go ahead and move on, because Megan pointed out that helping clients connect with the GA community and build peer support. That's great. So Megan, think about that. Hold on to that. Helping clients connect with the GA community and building peer support. So that it sounds like there might be a link there that you wish that you could figure out how to connect with. So that's great. Thank you, Megan. Mike, extensive collegiate programming across the state. So many different institutions, right? Large, small, urban, rural, in-person, virtual, et cetera, with colleges and universities all around the state. You've got Division 1, 2, 3, and you've got, junior colleges. You've got all these things that are in various different places, urban, rural. So how to extend that. That's great. And Joy, hi Joy, getting the state to recognize that gaming and gambling have different ways of manifesting themselves, and therefore both need to be taught. Right. So in Iowa, dealing with something similar that I understand that Mike and Derek are dealing with in Ohio is just this whole convergence of gaming and gambling and how to address that with limited funding. And then, thinking about how to collaborate with others to prevent excessive senior citizens gaming. Right. So that's another area where you think about that we could address, right, is preventing excessive senior citizens gaming, how to collaborate with others on that. So senior centers and that kind of thing. Better address sports gambling. School administration acknowledging the benefit of all forms of prevention, not just substance use and bullying and prevention. Problem gambling needs more time. Amen, Tracy. How to connect with schools and get buy-in for online gaming dangers. Okay, so kind of along the same vein there, Jose. So this is great. So it sounds like you all have a lot of different ideas around things that are really kind of across the spectrum of services. And we're going to look at that in a little bit. Relationship between gambling on the street and violence. Yes. Screening, how to transition screened clients into treatment. More education in schools regarding gaming. So much is coming in, you guys. This is great. Hold on to these things. And if you see something that somebody else has acknowledged, hold on to that as we move forward with this material. And connecting with the faith-based community as well. That's awesome. So you can keep those coming if you like, because others will be able to take a look at those and perhaps garner some ideas for themselves. And maybe you recognize a name. Part of the benefit of having a conference like this, although we can't run into each other in the hallway and complain about the crappy coffee, is that we can connect with each other in the chat box. You might recognize a name. And that's part of the idea here too. I'm not the sage on the stage. I'm kind of the guide on the side. So hopefully you recognize the name in there and you're like, oh, I recognize Lynn. Maybe we can connect about something. So that's really part of the idea of this whole piece as well. So thank you for mentioning all of these great ideas, virtual IOP for gambling across the state, better teaching critical thinking skills. Yeah, so there's just so much that we can do together, and you all are showing that right now. There's so many things that we still have to do in this work, and sometimes we feel alone in this work. And so knowing that each other are out there and trying to collaborate is really helpful. I'd like you to think about where your work is on this protractor of spectrum and of mental, emotional, behavioral intervention. So we used to call that the continuum of care. And think about where you are on there. And with the chat box, I see folks who are in sort of that health promotion and primary prevention category. And it sounds like we have people that are in that treatment category. So this is not to say that if you're doing treatment, you can't do prevention or anything else, but what this is for is kind of to think about where you might sit in that spectrum. And then as we move forward in this conversation together, is think about ways to partner with people that might not be on sort of your part of that spectrum. So think about that. And then finally, think about which of these particular sectors that you might represent. These are sectors that are used from drug-free communities grants that are typically really kind of try to gain a whole group of people across multiple sectors to then have collective impact. So we have the business, or in this case, industry, right? Civic groups. So you might think about your local community groups, education, faith community, government entities, healthcare partners, which by the way, today is Gambling Disorder Screening Day. So we want our folks to be able to engage with that. Other organizational advocates, law enforcement community, media, youth serving organizations, parents, and finally, youth. Last but definitely not least, as partners. So thinking about these sectors, you may fit into a few. You may be a parent and work with the industry and sit on the side with an Elks Club. So think about where you are with those sectors and just let that sink in for a minute, because that might actually help spur some things in terms of partnerships. Not to say that you don't want boundaries and have your appropriate boundaries in your work and say, okay, this is my work. I do go to church. I want to talk to the pastor about potentially having, talking about problem gambling with our church. Just being mindful of that we're not asking you to spend like 80 hours a week working on this stuff on your off time, but to think about potential partnerships with other sectors. All right, so that's the stage. Now, let's talk current conditions. Where are we now? Where is it working in Ohio? And some on the systems level may be able to address this a little bit easier, but I think, if you're on the ground level of things, you might be able to think about what is working. I will say, as an outsider perspective and someone who's worked on surveys across the US around problem gambling services, that you have some of the most robust services in the country. So please, those of you who are working on this, please give yourselves a huge pat on the back for the work that you're doing. You may feel like it's possibly like you're rolling the ball way uphill, but in terms of overall perspective in the US, you have an amazing set of partnerships. So what is working right now? These are a few of the connections that I can think of when looking at Ohio. You have Demas, you have Stacy working with Demas and doing all the great work with that, and Shemaine Marsh, and you have Scott Anderson working with the state level. You have Problem Gambling Network of Ohio. You have the Casino Control Commission and a lot of private entities, in which are partners, including Jack here in this session. You have your lottery, you have Kent State, and you have, which I just in the way of, is this partnership, the Get Set Before You Bet. So thinking about things that are working. Dr. Heather Chapman is here. The Dr. Chapman is here. Hi, Dr. Chapman. VA is working. Heck yeah. VA is working. Yeah. I mean, the work that Dr. Chapman is doing across the United States is seen as the beacon for working with VA, with working with veterans. So yes, that's working. Awesome point. High numbers of Ohioans screened and treated. Yay to all of you, says Stacy. Yeah, so, excellent. What else is working? If you gamble, get set before you bet. So Derek put on that beforeyoubet.org. Excellent. A lot of great tools on that website. Connected recently with Michigan Council to create training for their VA system. Awesome. Zoom Gambling Treatment Group since June has been very helpful in Toledo. That's awesome, Megan. Anything else that you can think of that's been working on your level, on your local level, on a systems level? Elaine says educating professionals, which is a great move to collaborate with mental health and substance use providers. Awesome. Introducing new topics like including gambling, like financial wellness. Great. Suicide prevention and gaming. Really innovative stuff. That's wonderful that you're making those connections. And that's what this is all about, is making those connections. Financial wellness, suicide prevention, gaming, online counseling. Something that the pandemic has actually given us a little bit of a boost with. Our group at Meridian says Brandy has been doing amazing things. Great. Faculty in service for school districts. Joy. Awesome. Bringing together gaming operators, regulators, prevention and treatment specialists in Ohio. Karen, that is so cool. I'd love to learn more about that. And Kelly says collaboration across several counties around Toledo related to prevention and treatment. So it sounds like you've been doing, Kelly, some really great connections with your partner agencies. Super great, because doing it alone is a Sisyphean task. Excellent. These are all great collaborations and great to hear about in the state of Ohio. So hats off to you for what's working. Sometimes we lead with what's not working. We're going to now go into what isn't working. I would like to do a poll question here, because we have 111 people and not everybody's going to be able to participate all the time with the chat. So Corey, can we pull up that first poll question, please? Thank you. Which of the following is or are primary barriers to collaboration in your work? So check all that apply. You can check all of them. You can check one. You can check none. Thinking about what is a primary barrier to collaboration in your work. Sarita, you have your hand up. Oh, now it's down. Okay. Just wanted to check and see if you wanted to contribute here. Okay, so we've got about 63% or 58% voted. Getting up there now. Providing in-class and virtual risky business education sessions in the chat. Okay, that's interesting. I'd like to learn more about that. Dr. Amanda Burke from Kent State University, sharing our knowledge, programs, and findings with each other so willingly. One of the best aspects of problem gambling work. So yeah, continuing on with what's working as everyone continues to vote, that's the awesome thing about the problem gambling field, is that people are so willing to share because we're all so, it's such a small field. And so the willingness to be able to share is a definite asset in our work. Thank you for that. All right, we're going to just stay open for another few seconds here. So let's keep those votes coming. Anybody who went to grab a second cup of coffee, head on over and click that button. All right, we're going to go ahead and finish the polling. So thank you for that. We're going to look at these results together. All right, so there's it seems like there's quite a wide spread of issues, and it would be interesting to see how many people clicked multiple buttons in this. Limitation by funders is definitely an issue. Work plan scope. Lack of partner buy-in seems to come in with as a number one on the list here. Partner funding and scope limitations, differing philosophies in the work, and then other. If you click that other button, go ahead and feel free to add that into the chat box about why you click that other button. I'd be curious to see what other barriers that you're finding that's not on that list. So thank you for participating in that poll. That gives us a little bit more information around setting the stage as we do discuss those barriers. Quick backdrop here. For those who are kind of new in the field and aren't so aware of what's going on with problem gambling is that, we have this federal funding for substance use disorder. We have federal funding for alcohol use disorder. We have federal funding for mental health issues, but we don't have a single solitary cent for problem gambling services in the United States. And to think about the vast expansion of legalized gambling in the United States in recent years, that is a problem. And it continues to be a problem for us. And so we're already starting off with this monumental barrier of having very few resources. If you compare the resources, and this is as a few years ago, so I'd like to just point out that this data is old. The last survey of problem gambling services throughout the United States of publicly funded problem gambling services was conducted in 2016. Interestingly enough, today, Kindbridge organization and just posted a news release around the sponsorship of a problem gambling services survey that's going to occur in the near future. So that's a plus. Just got the funding to be able to do that. And that's a host of different partners, Entain, Epic, and Kindbridge. And I might be forgetting a fourth. The organization that's doing that used to be called the Association of Problem Gambling Service Administrators. Never mind, I'm getting into the weeds, that this is old data. Substance use disorder has received, and this is comparative as of that year, $24 billion into investment into treatment. If you look at the picture, now that's just treatment. If you look at the picture comparatively on that right side, you see that only $71.6 million were invested into the full spectrum of problem gambling services in the United States. Ohio was one of those states with the best and most robust services and funding. So you can see there, it's 341 times smaller. Now, most of the funds come from states, and most of those states' funds come from industry. And so it's sort of this very, very top heavy, or excuse me, not top heavy, but almost a one-legged stool in terms of looking at how services are funded in the US and across the states. And so we have our work cut out for us for this. Now, that's not to say that everybody that's sitting in on this webinar has to do a whole lot about that, but it is saying that those of us on the advocacy level definitely need to keep pushing for this. Have you heard this too? Problem gambling isn't our problem. It's passing the buck. It's saying, look, we've got this narrow scope of services for which we are funded. We are overwhelmed and overtasked. I saw in one of the chat areas, it was talking about the need to address problem gambling and with those other areas in schools, and schools just don't see it as a problem. So that is an issue for us, where we see we have this huge uphill battle in terms of talking about problem gambling isn't our problem. Mike says we have other fish to fry. Right. It's a common problem because it's not that people necessarily don't even, want to address this issue. Maybe they even know somebody that has a gambling problem, but they're saying, look, our plates are so full right now. We've got bowling to address. We've got alcohol and other drugs to address. Look at this opioids problem, et cetera, et cetera, et cetera. And so we hear these things over and time again. And yeah, as Jose says, especially this year, right, with the pandemic, it's really fallen even lower on the priority list to be able to address. And then you think about our limited infrastructure and how our ability to then make that push is even more taxed and challenged. And so again, looking at those funding parameters, those narrow scopes of grants that a lot of us are dealing with, Joy mentioned in Iowa of integrating gaming and gambling. And oftentimes if we don't have the freedom or the leverage to be able to expand our grants or services or DSMs to be able to expand some services, that can be a real barrier for us. And if you're thinking about like on a state level, the ability to provide, I know Ohio has a wonderful infrastructure and definitely talk to those state folks around some of those funding parameters. When you look though at like some of the public health partnered things like tobacco grants, those are like super, super narrow, and asking them to partner on something is like beating your head against the wall. So there's some things that are just realistic. There's some things that aren't so realistic. So let's think about exploring that realm around what is realistic in terms of addressing limited parameters of funding. John asked, do all states have legal gambling? John, 48 states have legal gambling. The states of Utah and Hawaii don't. Most states have a state lottery. Many have casinos, whether they're tribal or private. In Ohio, you obviously have private. You have issues, you have sports wagering that's just become more popular. It's in 20 different states now legalized, and DC has legalized. And there's just a growing number of online lotteries that are available as well. So I hope that gets at that question. But when we think about legalization of gambling, oftentimes the policymakers who set things in place don't think about addressing responsible gambling or problem gambling services. Thankfully, you have BGN Ohio doing a lot of advocacy in Ohio. I know Derek's doing stuff all the time with advocating on a state level. So you've got a definite ally in looking at when things get expanded, how to get that help. We often hear this one. This was not in the questions in the poll, but we hear this a lot. We don't have enough data to prove there's a problem. Okay, so we don't have enough data. So how do we get the data? By doing a survey. How do we do the survey? By getting funding. How do we get funding? To prove that there's a problem. How do we prove a problem? We have data. So this has just been like, you know, I've been in this field for 19 years now, and it's been something that's continued to be an issue. Thankfully, now there are more surveys that are growing. You have surveys in Ohio. You have data at your fingertips now that are more available than ever. So if you have access to that data, share as much as you can. If you don't have access to that data, ask one of these partners here, because they have a whole wealth of information to be able to share with you. How about this one? Egos. People don't want to share. Oftentimes, and I know Dr. Burke mentioned that in our field, we are really good at sharing, and that's almost true entirely. Sometimes when somebody has an idea, they want to make it theirs, and then it's easy to box people out, and there's maybe could be a lack of a teamwork kind of approach on things. We often sometimes I've seen over the years too, is people just coming in and they just want to create something. Like, you know, what very well intended, but they just kind of want to create something. They want to have their kind of stamp on the work without really realizing what else is out there. And again, that's kind of the purpose here, is to have these conversations and also understand what's out there and potential partnerships with things so that we don't have to reinvent the wheel. Finally, we have burnout, right? I mean, we have so many people that are just, they're exhausted. You have this last year, which has been exhausting. It's understandable to feel kind of overwhelmed and burned out at sometimes. Sometimes, however, that gets in the way of progress and partnerships, especially if we kind of have our little blinders on and we just kind of hunker down and focus on our work without thinking a whole lot about connecting with each other. And that's where we have that opportunity to be able to connect, and hopefully that will help with burnout, is that ability. Yeah, Derek put in there, if you'd like board-specific gambling prevalence data for your area, contact Scott Anderson, and he listed Scott's email address in that chat box. And hopefully if folks are watching the recording, it's scott.anderson@mha.ohio.gov. Elaine says many people use what is out there, but market it under a different name. Yeah, that's pretty common too, right? You're using what's out there in the existing domain. And sometimes that creates an additional barrier because we don't have that sort of brand recognition, if you will, even if it's not a quote unquote brand, is, oh, hey, I remember that program. We used it in this county. Or, hey, I remember this thing. We used it with this school. So being able to kind of be able to share and then establish kind of a common name and not have to slap a new name on it is important. So how do we combat these barriers? We've got all of these things that are kind of this extra burden on us. And especially, this last year, we think about the burden. How do we combat this? Well, let's take a look at the spectrum of services and the strategic prevention framework. We don't want to get too in the weeds with terminology here, but it is kind of important for us to have a backdrop of what the strategic prevention framework is and the spectrum of services to kind of hopefully help us to get a little bit more engaged with how we can partner. So this is the spectrum of mental, emotional, and behavioral interventions, otherwise known as the continuum of care. And think about where your work was on the spectrum. And I think you looked at that initially when we took a look there. So go back to that, reflect where you are. And we're going to look at the strategic prevention framework. So the strategic prevention framework is pretty known to everyone on here. Yeah, my image is covering a part of the slide. So thank you for mentioning that, Cynthia. The reason I'm here is because it's like the least most important part of the slide. If there's anything that's going on that's most important, we'll make sure to address it. But it can be used for planning, not just for prevention. So strategic prevention framework, we use it in drug-free communities grants. We use it in most of our work in prevention to kind of think about how to plan something from start to finish to start again. And it's something that can be used for not just prevention, but even buying a car. And we'll look at it in a moment and why we think that's true. So if we're looking at, beating our barriers, the first thing we want to do is the first step in the strategic prevention framework is assessment. Derek, who loves SPIF? Yeah. Corey loves SPIF. I love SPIF. We call it SPIF. The first area of addressing it is with assessment. So if you're buying a car, the first thing you want to do is like figure out, okay, what cars are actually useful for me? What do I need as a car? What is it that I want to do? Do I want miles per gallon? Am I driving a lot? Do I want a truck? Am I going to be hauling stuff? Do I want to have a really cool looking car? Is comfort important to me? Is price most important? So assessing what you need. And in the community and strategic prevention framework, we start here. We have to kind of get the lay of the land about where we are. Now in Ohio, you have a better sort of stage around assessing needs. You have a better understanding about your needs than many other states do. And what we do is we kind of collect these data to kind of help us then identify what is it that we need to do? What is it we need to address? So if it's, for example, availability and access, we know now that we have our devices on us. We know that gaming and gambling are converging. These are areas of probably great need for us to address right now. Attitudes and norms. So thinking about how we perceive gambling as a whole is pretty positive, and understanding how we kind of combat those norms or at least address them. And then thinking about, problems and consequences. So treatment admissions, things like that. Thinking about potential for, arrests and citations related to embezzling or related to some other gambling related crime. So these are all kind of just examples of how we look at that, assessing our need. And when we assess our need, sometimes we think about that barrier of problem gambling isn't our problem. We have other fish to fry. So how do we address that? Well, we look at our data, we see what is going on with our community. We see if our community is ready to even think about addressing gambling. This is just a definition of what community readiness is. And what I would like to say is community readiness is really the community level of motivational interviewing, right? So if you're a clinician, you're sitting down with a client. The client's like, hey, I don't have a problem. I know why I'm here. That, that person, you're not going to jump right into action with that person. You're going to need to kind of move them along slowly around it, getting into contemplation, hopefully getting them to preparation, right? So community readiness is really, really similar to that. It's just on that grander community level. And when we think about community readiness, we are looking at where we are on a spectrum of problem gambling. We are typically not ready to address gambling head on. Just want to go to what Ken asks. Hello, Ken Mazzelli. Nice to see you. Thinking about buying your car and your priorities, adding to Mike's comment, not only other fish to fry, but bigger fish to fry, especially thinking about this year. That is absolutely right. So thank you for pointing that out. Yeah, bigger fish to fry this year. And so when we think about readiness to address gambling, especially this last year, it's probably even gone down more because people don't see it as a problem, especially if it's hidden, if we're isolated, if we're at home, if you're seeing clients online, you may not even necessarily kind of know what's going on with them and their behaviors because it's easy to hide gambling, which is why screening is so important. But if your community isn't ready, which most of our communities aren't, in Oregon, we actually did community of readiness assessments with key stakeholders around the state in almost all counties. And most were in stage 1 or 2, which is community tolerance or no knowledge, and stage 2 denial, which basically means that we're in kind of this pre-contemplation. There's the stage 3, which some counties are kind of in, which is this vague awareness, kind of like, yeah, contemplation. And so if we kind of go in and we just try to shove a policy down into a county level, if the county is not ready to address, like say the workplace policy, probably not likely to happen. We have to establish that understanding first that something is an issue to address before we can then move forward. Catherine says, I'm doing a community readiness for gambling in 3 different counties in Ohio. So far, I'm showing no knowledge or denial. Thank you for that. That's great to hear that ground level data in Ohio, Catherine, and thank you for your work with doing that readiness. And thank you, Derek, for pointing out, if you're interested in completing a community readiness assessment, the resources that you have available on the state level at pfs.ohio.gov. So thank you so much for posting that, Derek. As a prevention specialist, you get it. So the other things to do is to just kind of find out where your resources are. And these resources can be money, it can be existing things that are out there, finding the lay of the land, asking your partners. If you're new in this work, please reach out to people. People are so willing to help. And obviously on that state level, you have people that just are so willing to share, and you have county providers that are so wanting to help with that, getting kind of a leg up on what's going on. Communities don't always use the same type of language, so must use the language that the community understands, says M. Garner. Example, some people say they have no gambling, but if you say betting, they will say yes and understand what is being asked. Thank you so much for pointing that out. Sometimes we don't know the questions to ask. Sometimes we don't ask the right questions. And if we say gambling, most people go to their minds, they think of, okay, I think of the casino. So asking them, hey, you ever play Powerball? Oh yeah, I guess I might play Powerball. Have you ever, done a little sports wager with a friend on the Super Bowl? Which, by the way, your Browns are going to be back. And so if you think about like ways of addressing this in a different way, then you'll get to those improved responses. So asking the right kind of questions. So thank you for pointing that out. And Ramirez says, I've been implementing this into SUD IOP groups I'm presenting. Intro to responsible gambling. It's been really clutch. Awesome. I'm so glad to hear that. That's great. Right. Because if you think about people in recovery, you're making that connection and that partnership with people in substance use disorder recovery are much more likely than to also then have a gambling problem. So in recovery, using those connections to talk about being responsible with and safer with their gambling. Joy says we did this in Iowa too, so that's good. Of course, we know that gambling is a hidden issue. We might want to look at suicide data and mental health data to put it in context for the general public. So again, that context for the general public, making those connections. Gambling isn't a silo. Gambling isn't on its own. And the more we can leverage those other issues, the more it's going to get on people's radar. Some of us have been beating our heads on the wall trying to do this for years, but video gaming is gaining traction. So If we can hitch our wagon to that and find a way to then use our funds to be able to also address gaming alongside of gambling, starting with that convergence that's there, we can perhaps get some movement on that. So that's the area when we look at as kind of building the lay of the land, finding out what's going on. The second stage is we really want to then find out where our partners are and build the capacity, build our teamwork to be able to address that. So if we're buying a car, we think about, all right, what kind of cash do I have? Do I need a loan? What other, if there's, if I'm 16 years old, I might see if mom or dad or aunt might help me out. Understanding sort of that where our resources lie. And obviously in gambling, it's broader with thinking about human resources. You have ground level people all across your state. You have state level folks all across your that are doing the state level work. And so you have this great ability to then be able to partner. Thinking aside from that is thinking about those other partners. So as Ann Ramirez pointed out, that whole ability to connect with substance use disorder treatment. Understanding what other collectiveness that you have to be able to address this with issues with diversity, equity, and inclusion, which has been often forgotten, with health disparities, engaging individuals at higher risk in marginalized communities. So thinking about Black, Indigenous, people of color, LGBTQ+, engaging them in the conversation and meeting them where they're at. Professional development of staff. So building that capacity with our allies in professional development of them to be able to address, oh, wow, I guess this is an issue. And I'm sorry, some of the names are cut off. I see AN. I believe suicide data and mental health play a huge part. That's a great point. So talking about the suicidal ideation of people with gambling problems and thinking about mental health conditions and those kind of co-occurring disorders and issues there. And Dr. Chapman can speak really well to a lot of these areas. And I know that you have a lot of clinicians that can as well. The third thing is you want to prioritize our solutions. So you might think, okay, well, I really want to get this Ford F-350 or this Tesla. Can I afford it? How important is getting this Ford F-350 to me? Can I afford maybe a Ford F-150? Maybe I'm looking at a Toyota Tacoma and thinking about, well, the resale value on that's really good. It's almost like an investment if I buy a Toyota Tacoma. So thinking about things that are the prioritization for you. What's most important to me? The cost, the size of the thing, the miles per gallon, the comfort, so forth. So we think about in the community level of working on this, prioritizing our solutions together. What is the most realistic for me to do? And taking a break here just for a moment. We're taxed. We have a lot on our plates. You all are doing probably way more work than you're getting. I mean, surely way more work than you're getting paid for. Well, people that are in this field didn't come into it for the money, for sure. Right. So this isn't to say that we need to do it all. It's picking a priority. It's thinking about what is one thing that I can do in the near future? Who is one partner that I can work with? What is one issue I can do and be able to tackle it realistically? So taking it all in and looking at this whole big picture can be really overwhelming. So this is why prioritization is really important in this work. When we plan, we've got to think about what's most realistic. Using that data that we have from assessing community need, using that information that we have from building our capacity. What is it that we can realistically do? Picking one thing, maybe two if you're really ambitious, but realistically, probably one. Ultimately, it's supposed to make your life a little bit easier to be able to partner. But initially, we know that legwork is hard. So planning. The fourth one is implementing. And this is where, as soon as anybody gets any funding, this is right where they want to jump. And it's important first that we build that foundation with assessment, planning, and capacity building. So we're going to establish those first 3 points before we jump into implementing. This is why a lot of times when politicians talk about getting funding for stuff, they want to immediately throw money into something that's really flashy and that ultimately makes no big difference over time. So in order to do this, we think about effective use of using those first 3 steps and then implementing those things. And then talking with those subpopulations who are greater, marginalized and affected, the know about us without us kind of planning. Finally, evaluating. And this is the most difficult part for a lot of us to do because sometimes our resources are so limiting that we don't have a whole comprehensive longitudinal approach. In Ohio, you have great surveys, great evaluations, and so you have a wealth of data to be able to get. And at the state level, you've got your state partners to be able to help you out with that information. We think about as evaluation, not just as like, hey, how did we do? Did we do what we say we were going to do? But also to kind of monitor where we are along the way. Like, is this thing actually working? Maybe it's not. Maybe we need to tweak something. So be able to do that as well. We also want to think about how we're doing cultural responsiveness is like sometimes we have this one size fits all approach to our things, and prevention. Sometimes we have these great curricula that are out there, but they don't address rural, so low socioeconomic BIPOC communities. So there's a lot that we still need to do with our work, with helping out with that piece. And again, you don't have to create all this. We want to all partner together to really start engaging with each other around planning these things, because it can feel really lonely if you're in an area where you're expected to do all this and you don't have the tools to be able to do it. M. Garner says getting cooperation in or by will be different based on communities. Engaging with communities in ways that different communities understand is key. Also, some communities have lots of people constantly engaging, but not necessarily hearing what the community says is effective. Stopping there, because that is so important to hear. Lots of people constantly engaging, but not necessarily hearing what the community says is effective. We must listen to the communities. Oftentimes we must build equity before doing the program. Not every community starts from a level playing field, so it's important to get community buy-in. If we're not getting community buy-in on something, they're just going to look at us as the man coming in and telling them what to do, right? So I really appreciate that comment, because we hear it and sometimes we don't really hear it. And so really listening to what the community says is effective. So this is where oftentimes we get the rub, because when we have funding requirements that tell us we need to do something a certain way, sometimes we get like stuck. We're like, well, you're saying this works, but we can't do that. And so it's coming back to our funders and partners and be able to sort of see if there are ways that we can be able to apply different strategies that the community says is effective. So thank you so much for that. Not every community starts from a level playing field. Absolutely. And that's vital to think about. We oftentimes hear, like, especially over this last year, we're all in the same boat. Yeah, well, one of the things that I've heard most recently that I really appreciated was we're all in the same storm, but some of us have a yacht, some of us have canoes, some of us are hanging on to like a piece of wood, right? So we are all in the same storm, but we're not all in the same boat, and acknowledging that is really important, especially if you think about trying to apply something in a community. And we want to address cultural humility. The SPIF calls it cultural competence. There's a lot of conversation lately about nobody truly being competent in cultures, but if you're having problems seeing some of these slides due to my mug being in the way, please be aware that the slide deck will be available to you, so you'll be able to have that as well. But I am pointing these pieces out as well. So kind of to just bring that home around some of the pieces that we've already talked about is throughout all of the stages of the strategic prevention framework, we have to involve and be aware of our own blinders with regard to cultural awareness. So being responsive, engaging communities, as M. Garner said, is just meeting people where they're at in their communities, understanding what's working in their communities. Oftentimes we kind of bring in a token person to want to be on our committees. And, when we talk about working with all 12 sectors, it's not to try to get somebody in there just so we can check a box. It's so we can truly engage and understand where we can do better. Sustainability is also part of the strategic prevention framework. And when we look at that, we want to engage partners who, we think about, like, sometimes we get these funding streams and we get this like 3-year grant. right? And you get the 3-year grant and you're like, okay, we're going to do something. And then you go through this stuff and then the grant's over and program falls out. Anybody that resonate with anybody? I mean, I've had it multiple times where we've had this thing and we talk about sustainability, but sometimes we have realistically unsustainable things. Yeah, Nami Wood County says, who hasn't been there? You get a grant, you're excited, you hope to continue it, and the funding dries up. And so a plan of sustainability sometimes is harder realistically than others, but to think about ways that we can at least sustain some of the key processes involved. So how we got somewhere, and then hopefully be able to leverage that for other resources in the future. All right, so we've gone through the strategic prevention framework. Before we move on, let's sit with that for a second. We've gone through assessment, capacity building, planning, implementation, and evaluation. And those and through those all cross-cutting, we have sustainability and cultural humility. Let's launch a poll and see what area within the SPIF do you think is least realistic for you to collaborate in? Assessment, capacity building, planning, implementation, or evaluation. Least realistic for you to collaborate. And if anybody has any extra comments or questions you feel like you want to throw in that chat box, feel free to do so while folks are voting. We're also going to be doing another poll around what's most realistic to collaborate. So we're going to take a look at these and right on the backs of one another. All right, got just over 2/3 of you voting. Good deal. Keep it coming. All right, let's go ahead and close that polling and find out what's going on here. So it seems like evaluation tends to be the top of the list. It is also in Ohio. Looking at assessment, capacity building, and implementation are sort of in second place there as tie, and then planning. Planning seems to be the easiest to collaborate on, which is interesting. So this might not be that useful of a poll for you, but hopefully it just kind of when you're thinking about the hardest part of your work and where you might be able to fit some of those areas in. When you buy that car and that implementation piece, if you're buying that car with somebody, if you're buying it on your own, implementing that purchase, evaluating the purchase, thinking about all of these things together is how do we collectively buy that car and that implementation. If there are people that we can partner with, that seems to be a challenge for some people in evaluating that purchase. And oftentimes, and maybe correct me if I'm wrong in the chat, but that evaluation is the hardest for us to collaborate on because oftentimes we don't have the resources to do the evaluation. So I'd be curious if you have other thoughts with that. Let's go on to the next question, which is what area do you think is most realistic for you to collaborate on? And I spelled evaluation wrong again. All right, but you get it. What are areas with SPIF that you think is most realistic to collaborate? So assessment, capacity, planning, implementation, or evaluation. Oh, people are voting fast on this one. Nice work, peeps. Larry points out it's also important to build trust when engaging different communities, and that takes time. Thank you for pointing that out, right? Because if we want to partner with different communities, it takes time, especially if you want to come in there. We often, when I was working in local government, we often used to joke about it because local community coalitions would be like, here comes the local government person 5 minutes late with their Starbucks again. And then they tell us what we need to do. Right. So thinking about that building that relationship, that trust, it takes a lot of time sometimes, which can be frustrating when we feel like we need these outcomes, but it is imperative. All right, thank you for voting on that. And look at that, assessment seems to be the most realistic to collaborate on. Great, because that's the first step in the spiff. And if you haven't yet done a lot of collaboration, that's great news, because that means that you think that you might know people to partner with and assess the lay of the land in your community. So that's great. Planning, okay, that was converse of the least realistic. So that seems to be right on par there, that's most realistic. Capacity building in third, implementation in fourth, and evaluation last place. Pretty on par with what we think is going on overall. So let's take the spiff. Let's take the car that we've purchased and hopefully, did some evaluation on, and let's think about how to go across that, from that assessing our needs to purchase a car all the way through that. How did we do with buying the car? So again, we are back at that mental, emotional, and behavioral interventions, the protractor, as some of us call it. Where do you think that you might be able to partner with somebody that's not in your spot on the protractor? Any of this information that we have kind of gone through in the little under an hour now is talking about, where do you think that you might be able to find some partners? This can be rhetorical. You can put stuff in the chat, but I want you to think about that problem that you first came up with when we first started this thing. What is one of the areas that you want to collaborate on? And which allies do you think that you could collaborate on? Sharon says, I would rather try and prevent than treat any addiction. Yes, yes, thank you for that. Oftentimes our resources go into the intensiveness of the clinical area, which we're going to look at in a moment. But yes, prevention would be awesome, ideally. But we need all of us to be able to do the work. Lynn says Ohio seems to have the best connections for collaboration due to the willingness and availability of industry providers and funders making connections and willingness to help each other. Yeah, I mean, that is so cool, because you all have done that groundwork. It's taken time. It didn't happen overnight. And so if you are new in this area, be aware that you do have this great infrastructure and partners to be able to work with. And if you're still banging your head against the wall, if you've been doing this for a long time, there are pieces that hopefully you'll be able to find, that you'll be able to work together with as a result of this conversation. Sharon says, I am treatment, but have friends in prevention to collaborate with. Awesome. Well, yeah, because sometimes we're in our own work, we're doing our own thing. You might have like 7 clients to see in one day, and then you've got all this paperwork to do, and you're like, oh wait, you want me to connect with who? These prevention people? And conversely, in prevention. So thinking about those partnerships is super important. And oftentimes that's the most traction that I've been able to have in my work. And I know that several colleagues have said the same. So M. Garner, I like treatment, long-term treatment and aftercare. That's typically where I work. Okay, so you're thinking about where you are. I know a clinician who works in the treatment I am doing and prevention at the same time. That's a heavy lift, doing prevention and treatment at the same time. Wow. Yeah, so Joy points out a common thread among people in prevention who often feel like we're like the little kid on the playground that doesn't get picked to play, is prevention ultimately saves money. So it is a great way to sell the need. The downside is, of course, we often don't see the results of prevention because we only plant the seeds. This is why it seems to be harder for buy-in for funding. Yes, it takes a long time. And as Derek pointed out, it's so important to recognize and celebrate our collaboration. It's unique, and we've come a long way in the last 5-10 years. And thank you for your work and leadership, Mike and Stacy. And collaboration is with recovery advocates is key. Mm-hmm. So thinking about these sectors, let's launch our last, second to last poll question. Which sectors can you think of as allies? So thinking about these 12 sectors, where do you think that you might be able to work best? And this is checking all that apply. All right, so anybody watching the recording, we're doing some voting here. People are bringing in votes around the 12 sectors and where they think they could collaborate. And it kind of got chopped up into 2 different questions, but you can see that you can still vote in any one of those. We've got about half of the votes in right now. Okay. All right. Well, we are seeing a great, beautiful spread of sectors. And this is really nice to see, y'all, because you have a lot of different opportunities to work with different parts of the sector, and maybe those are areas that you're already in and maybe they're not. But it looks like other state, local, and tribal government agencies are 7 out of 10 of you voted for that. And again, you've got that great infrastructure there. So that's wonderful to see. And then you've got this whole breadth of the 12 sectors and other organization involved in reducing problem behaviors. 74% of you have said that. So I'd love to hear if you have a specific organization in reducing problem behaviors to put that in the chat box, because hopefully someone else will see that and go, oh, hey, I recognize that group or that agency or that partner. So if you voted for that one and you can think of a specific organization, put that in the chat box, because this is about you. This is about your connections in your communities and hopefully being able to make those connections, especially if you're newer in the field. So these 12 sectors, and it takes all of us. In order to have collective impact, community impact, it takes this whole thing. So we went over the whole buying the car thing, right? But we also want to think about our impact in all this stuff. So the buying the car, this is the whole process around it. But then what do we do, right? Okay, we know the process, but then what is it that we're trying to do here? Like specifically, what areas are we trying to address? And this is where public health approach to problem gambling is really necessary. And especially if we're looking at partnering, we need to look at this as a whole picture. And this is kind of apologies, but this has been an area of great passion and sort of soapboxiness, if you will, around the issue of this, because we have focused on the individual. Again, this is an opinion. We've focused on the individual for far too long. We keep putting the onus back on the person. Here are your responsible gambling tips. Here's this help that we can provide you. Here is this education that we can give you. Yes, those are extremely important. And without a comprehensive approach that looks at from looking at research and development of legalized games, from looking at how the operator's responsibility is in this, and looking at safeguards and laws, and looking at pre-commitment tools, and all the way through into prevention education and clinical treatment, it takes that whole thing. And this is where I got to beat this drum on this health impact pyramid, because if we're going to partner together, we need to see what we can partner on with and how this can take us whole perspective of public health to look at it. So we look at this clinical interventions, this first piece here on this counseling and education, extremely important, extremely impactful on the individual level. You all who are doing that clinical work are doing yeoman's work of being able to help people save lives. You're saving lives. So this is saying your piece is really important. Your piece is also very expensive. Education, billboards, flyers, prevention, stuff like that. It's helpful because it's information dissemination, but it's one small piece of the pie. Collective impact goes, the lower we go down in that pyramid, the higher collective impact that we have. And so we got to think about going all the way down on that pyramid. So if we go down a little bit on that pyramid, we're thinking about things. These are just examples, is coping skills, screening. Hey, it's it's Gambling Screening Disorder Day. Gambling Disorder Screening Day today, March 9th. We think about these two areas at the top of the information and the top of the pyramid, excuse me, providing information and support, looking at those pre-commitment tools and those first two areas of the pyramid. I had them kind of inverse there, my apologies. Then we go down on the pyramid, we think about those long lasting protective interventions. So exclusions, brief interventions, prevention curriculum. So thinking about where we sit on that, where do you sit on any of this stuff? Is there a way that you can provide these brief interventions? Is curriculum, who can support those things in your area? As we move down in the pyramid is changing the context. So in prevention, we call those environmental strategies. So thinking about things, and for those who are in the industry is those online safeguards. If you do have those social casino games in your casino online, is being able to implement those proper age gate restrictions, online safeguards with regard to any other safe play tools, and being able to kind of implement those initially. Standards on products, price, placement, and promotion, as we call the 4 Ps, is where do we put our ads? Are they available to young people? Are they available to people that are in recovery? Are we sending incentives for people that have already self-excluded? So those kind of things, those are policies, and changing the context to make the default condition healthy. Physical design of things. So sometimes this is out of our reach, but at least having those initial conversations with partners around that. And then finally, socioeconomic factors. So when we look at housing, poverty, education, and equality, this is the toughest nut to crack when we look at problem gambling. We're like, how do we change these factors? We can by doing a small part, and the small part is an extremely important part, which is addressing those health disparities in problem gambling services. Are we reaching the populations that are marginalized and at are greater risk? Are we doing outreach to those communities? And again, going back to SPIF is like, oh my gosh, I don't have the capacity to do this. Okay, so are there partners who are doing this work? Is there like a Latino services agency that you can work with and say, hey, we've got this problem gambling services here, and how can we provide some outreach or support or support you to do that outreach? And then advocating for health equity in those collective spaces, if there are greater partnerships that you have, and just being a part of those health equity conversations with representing problem gambling. Joy says, recognizing how many ACEs happen throughout problem gambling is a helpful way to pique interest in some. So right, ACEs, so adverse childhood experiences, and thinking about early childhood trauma as being a major risk factor for problem gambling that we don't often hear about. And the research bears it is true, is that adverse childhood experiences are really critical in addressing to combat problem gambling. So thank you for that, Joy. So this whole thing is collective impact, providing information, providing support, changing the physical design, changing policies. These are all part of the collective pie that we can use when we're thinking about this. So if you're thinking about partnering, if you think about where you are on that sort of in the 12 sectors, think about where you are on that social, mental, emotional continuum of the protractor. Where are you from health promotion through recovery? Think about your problem that you initially talked about in the session, and consider what's one thing. Again, prioritization, right? We're not here to say we're just going to add a whole crap load of work to your plate, a very, very full plate. What's one thing that you might be able to do to collaborate? One thing extra, or an ally that you didn't know you had, or a initiative that you think that you could be a part of. One thing, just one. And throw those in the chat box as we move forward here. So one area that we're thinking about right now is in the area of gaming is talking to the gaming industry, video gaming industry. So working with them around, hey, we have this convergence of gaming and gambling. So is there a way that we can connect with you around providing more resources and frankly, money, if there's a local partner that offers that. Talking with our local governments around these issues to be able to partner. We have someone that pointed out communication. So I'd love to hear more about what that looks like. Dora says survey. So is that getting the survey from your local partners, or is that conducting a survey? I'd be curious to hear about that. Joy says relationship building within coalitions. So pausing there. So thank you, Joy. Relationship building within coalitions. So oftentimes you may have a partner coalition that is specifically grant funded, and they're supposed to work on substance use, for example, or youth substance use. And that organization may be like, we can't really fit gambling in here because that's not within our scope and funding stream. Is at least building that relationship and then being at the table and collective or virtual table, and then just at least providing some of the information there. Cheryl says, develop relationships with community partners that I might not have been aware of. Okay. Good. Hopefully you have some of those community partners in mind and be able to share with one another, knowing who's at the table here. Again, I apologize. Some of these names are cut off. It's CAR. So if Carrie, Carolyn, Carl, I'm looking forward to working with the faith community again to take our program into churches again. Yeah, cool. Yeah. So sometimes the faith community partners can be awesome to work with, especially if you're able to kind of just even get some of the information out there. Sometimes you can provide a guest message. There's or just be on the ground level with some of the local volunteer activities and things like that to be able to share the message. Justina says, using existing partnerships from the Drug Free Coalition I oversee to incorporate gambling prevention info. Awesome. That's great. So using those existing partnerships from the Drug Free Coalition. So if you manage a Drug Free Coalition, or if you're on a Drug Free Coalition, you know those community partners. You may have some partners that are in the industry. You may have law enforcement. You may have faith. You may have other community organizations that you can then work with. Gail says, finding nuggets of common ground. Right. Where can we meet? Where are we connected more than where we're different? Tracy says, discuss value added to sectors to encourage a common language. Okay, I'd be curious to learn more about that, Tracy. Discuss value added to sectors to encourage a common language. I really love to learn more about that and how you like to use that. And Doctor says, expanding stakeholder collaboration. For example, recovery community, faith-based, etc. Okay, great. So yeah, that collaborative approach to working on this issue. I think it's Elaine says, one of the other panelists put down teaching children critical thinking, which is a staple of cognitive therapy. I would like to see teachers trained in challenging of distorted thinking, which is also another name for Socratic questioning. Yeah, so I love that thinking, Elaine. Talking about critical thinking. Sometimes we think of media literacy. We think of decision-making skills and coping skills, impulse control curriculum, there's one curriculum out there that's called the Good Behavior Game, which is a classroom management strategy, which improves impulse control, which, as we know, is a risk factor for problem gambling. So thinking kind of outside of those boxes. I love that thinking, Elaine. And Ramirez says, wanting to work more with people with disabilities. Yeah, so talk about another population at greater risk, whether it be physical, whether it be intellectual, developmental disabilities. People with disabilities have higher risk. And then you think about the pandemic and how that has influenced access to things. And we think about potential for online gaming and gambling behavior being more at risk. So really appreciate that you're thinking about wanting to work with more with people with disabilities. Tracy says, we use our own lingo. Okay, so you're back to that. We use our own lingo, use plain language so everyone understands and not separates. Yeah, so I think that's really important too, because even in prevention, we have kind of two different models. We have primary through tertiary prevention, and we have this universal through indicated prevention. It's all the same. It's just a matter of how we identify it. And so, I would just encourage us as we meet with those public health partners to use the public health language, as we meet with the SAMHSA people to use the SAMHSA language, and so forth, is meeting people where they're at, so that we can improve that connection and rapport. Bruce says, continue to make the sell to courts and other legal agencies. Yes. One great advocate that's doing the work throughout the United States is Judge Cheryl Moss, who's actually doing a gambling disorder treatment court. And she's trying to get all over the country to get this going. She has a court in Nevada. She's working on New Jersey and a few other states right now. And it's really, really cool to see that, to think about a drug court as being potential for helping people get into treatment as opposed to criminalizing their behavior. So those are all some great thoughts, y'all. Really love seeing these. And finally, Melissa says, if people can't or don't have time for a strategic prevention framework, focus on a thorough assessment with our clients to help coordinate care. All right. Thank you, Melissa, for that. If you don't have time to do the whole spiff, which you might not even think that you're doing it sometimes, but you're doing it. Even if you're buying a car, you're kind of doing the spiff, unless you just kind of run out to the lot and buy a car without thinking about it. You're focusing on those assessments as thoroughly as you can with your clients to help coordinate that care is important. And then that goes back to then screening, right? We got to screen for this. We got to screen for, we got to have it in our, all of our agencies, substance use disorder treatment through all of the work that we do. Anything else that kind of maybe we missed the mark on, didn't catch, any other thoughts that you have with regard to kind of de-silifying our work and improving our collaboration together? Again, the conversations today isn't about like, hey, this is how you do it. I'm here to show you. It's more collaborative. Like, it's the spirit of this whole thing is about how to connect and collaborate in ways that we can hopefully improve our work together, because we're not in this alone. That's the darndest true thing that especially we found out this last year, is that we're really not in this alone, that we do have partners and sometimes we don't even recognize them. And so I'm curious, what else is out there? What else is missing? Do you have any comments? Does anybody want to get unmuted, as we have just a couple of more minutes here to wrap up? Thank you for that comment. Really enjoyed this presentation. Unison Anita says, I like the collaboration process and to know that there are people out there to help. Yeah, sometimes we can feel like we're on our own little island. My kids and I just watched the movie Castaway with Tom Hanks more than 20 years ago now. And we're just thinking about like him being out on this island and developing this relationship with this little volleyball and how alone that felt. And he didn't have anybody to connect with. And that's one thing about Ohio. Well, many things about Ohio that are awesome. But thinking about the wonderful partners on state and local levels that you have to be able that are already doing this work and that are so willing to help you out. And so with that, I just want to say thank you so much for your time and attention and engagement, because it's not easy, again, when you have these competing priorities. This picture here is from Cleveland Rocks 2018, best National Council on Problem Gambling Conference ever. You can see Mr. Mike Bazzelli there in the middle, and Derek's there somewhere, I think. Maybe he was off running doing stuff, I forgot. But this is from the prevention committee there. We are always happy to connect. The NCPG has many different groups and prevention's one of them. Derek is a great partner. Mike's on the co-chair of the prevention committee. So many different partners that we have to connect with. So Dr. Brene Brown, which is like one of my heroes in life, she says, we don't have to do all of it alone. We were never meant to. And the point of this always is that we really hopefully can all stay connected. Please do stay connected with me. I'd love to be able to help out in any way possible, because this work isn't going to do it on its own. So thank you so very much to PGN Ohio and to all of y'all doing this work in Ohio.
Thank you so much, Julie. I think we'll open it up for just some questions. But before we do so, I know we have limited time. I want to launch the last poll just for knowledge check to verify attendance. So I'm going to go ahead and launch that now. If you cannot see that poll, then you might be in full screen mode. So I'll also drop the question into the chat box and feel free to engage with it there.
Well, and I think Julie's session, and thank you again, Julie, for presenting this awesome session. So much great information, and letting folks chat in and ask questions and just talk about what they're doing. That plays well into. I would just want to remind everybody about Thursdays of our conference. After the afternoon session, we have networking sessions. So, please remember that that's an option. There are no CEUs, but it's simply a networking session to meet people in your sector, outside in the other sector, the whole continuum of care. So remember that that's an option at 2:45 on Thursday to jump on and chat with other folks in Ohio and outside of Ohio. Last week, we had folks in and out of Ohio and representing the entire continuum of care. So just remember that that's a way to further connect with people and discuss the sessions of the week, but also what everyone's doing. So that fits really well in with this session.